Hi, everyone. Welcome to Nursing Home Quality Essentials. While everyone's kind of filing in, if you all could put your name into chat and maybe your facility or organization, and then maybe a dessert that you are looking forward to for the holiday. We'll get started pretty shortly here at the top of the hour. All right, we're at the top of the hour. So again, welcome everyone to Nursing Home Quality Essentials. Um, my name's Mariah. I'm a senior quality improvement facilitator here at Telegen. And today we're going to be talking about transforming rounds into effective action. I'm really excited to share this presentation with you all today. We do have a guest speaker who will be joining and speaking later in this presentation. So I'll go ahead and get started. Just a couple of housekeeping items. Here is just our nursing home quality essentials spotlight and infection prevention. Just as part of our contract extension, we're thrilled to just relaunch this and have you all join and participate in these sessions. So thank you so much. And here are just a couple of ways to get some information about events or updates that are coming down the pipes. We have that QI Connect at telegen.com. That's one way that we communicate with all of our enrolled nursing homes. And then we still have our Facebook and LinkedIn as well. All right, so here are the objectives today that I hope you'll take away from this presentation. And so we'll be discussing the importance of infection prevention and control rounding, demonstrate how to turn infection prevention and control interventions into effective actions, review common challenges and solutions in infection prevention and control rounding, and then identify proactive approaches to infection prevention compliance. I will have a couple of polling questions through in the presentation today, and then we'll ask that for any kind of responses into chat. So please feel free to enter into chat or come off of mute. Really encourage sharing because it's an opportunity for all of us for learning and sharing of interventions. So here we have what is the purpose of rounding? I think we're all pretty familiar, but as a quick overview, the overall goal and purpose of our rounds are to minimize the risk of healthcare associated infections by promoting consistency and adherence to evidence-based infection control practices. We're assessing the facility's everyday environment. Our rounds provide direct observations of staff performing everyday tasks like hand hygiene, environmental service cleaning, adherence to isolation precautions. We're checking the cleanliness of our patient resident rooms, our equipment, in any of the common areas within our facilities. We're monitoring the practices of patient care and staff practices in real time. So rounding provides us with a lot of insight, some being a great opportunity to provide real-time feedback to staff and it also allows for data collection and to review how effective maybe our onboarding process is with new staff. As Tina mentioned last week, these rounds should be used as an opportunity for improvement and not punishment. And so here we have our first polling question. I wanted to learn a little bit about the types of rounds, focus areas that you all do. You'll see on your screen, the poll is going to pop up. This is a select all that apply. So please select whichever ones you're doing and we'll review the results. So we'll just give everyone a moment. Awesome. All right, so we're seeing, right, a lot of hand hygiene, PPE, antibiotic stewardship, all of the above, which is great. And then we're seeing a couple for environmental service cleaning and disinfection and of waste disposal. So that's really great to see as for the rounding. So then we'll go ahead. Interventions into action. So the first thing we're going to take a look at is effective communication. What does effective communication look like for you? How does everyone know that the interventions are being put into place? It's important that during our rounds, we are providing regular updates and reinforcement. You may want to consider engaging with staff in discussions on infection prevention and control practices. Maybe ask their feedback on how the interventions that you have implemented with your team are working, or maybe to see maybe what's not working. And you could also ask for the recommendations at that time since they're um, on the floor and on the forefront. Oh, sorry. Um, and so then the second is we want to make sure that we have clear protocols and guidelines. Are the protocols and guidelines that we're providing, are they clear, concise, and actionable steps to follow for each intervention? And one thing to consider is though something might be clear to you as a person who is implementing the intervention, is it clear to all of your staff, whether it's within the nursing department, environmental services, dietary activities, and with implementation of new practices or expectations that you want to make sure you have them maybe written out and having a visual. So this might look like something as far maybe like as a checklist. We also want to take a look at our training and education. I encourage everyone to take a look at their training. Is it in a way that works best for all learning styles? Is there a visual? Are we doing it just through conversations? And you may sometimes have that staff member that you're speaking to, providing the education, and they may be saying yes, nodding their head yes, and indicating that they understand. But something to consider is what does your feedback system look like? So what kind of knowledge checks are we doing? Do you do a return demonstration? Are we doing any kind of follow-up auditing? Is there maybe a quiz that we're doing when we're doing our educations and training? And then we have positive reinforcement and then in staff buy-in. So when getting staff buy-in and onboarding with the new intervention, we want to consider WIFMs. So what's in it for me? When we're celebrating our successes, are you providing that recognition to those team members or units so that everyone knows and sees and that can joining everyone for a successful team? And then lastly, just one thing to kind of consider is how are we providing constructive feedback? So some strategies for adherence. It's always helpful to have leadership engagement. Support from leadership is critical to sustaining those new interventions for your infection prevention and control practices. Audits and feedbacks. So regular audits to measure compliance to try to help with determining your progress towards your SMART goal. And as I mentioned earlier, I really encourage you to share your results. Maybe you have a QAPI board so that everyone can see the progress that's being made um, to our project. When I say for everyone, it can be something for staff, residents, maybe even visitors to all meet that goal. So then we'll take a look at the just culture. So what is a just culture? A just culture is a system of shared accountability that encourages employees to report errors and system vulnerabilities while holding organizations accountable for their systems and employee behaviors. So encouraging a non-punitive approach to reporting and addressing infection prevention and control challenges. Focus on the process and not the people. So over here on the right, you'll see there's this kind of like uh, pinwheel. And so this kind of just talks about the just culture algorithm, which includes effective investigations of current practices and events, having clear articulated values, integrating the just culture concepts into daily practices, identifying obstacles between values and practices, and then lastly, creating a culture for learning for staff and management. So we're talking a little bit about infection prevention and control rounding tools, and there's a multitude of infection control tools that you can use. Maybe they look like checklists and standardized forms, and maybe we're doing those rounds daily or weekly. Maybe we're integrating surveillance systems, so using our electronic health records to track infections or compliance, and then, or maybe we have, excuse me, a dashboard where we're sharing real-time data, again, on hand hygiene compliance, PPE, or those infection rates. Here, we have Telegen's nursing home COVID-19 infection prevention rounding tool as an example of what could be used. We do offer on-sites and virtual tours to help support with infection prevention and control practices. The main focus on this tool is processes. So for those of you that may have already participated in a tour, this might sound a little bit familiar, but we'll ask some questions. For example, does environmental services know the process of terminal cleaning? So though that's a yes/no question, our next follow-up question would be, could you please explain the process so that we're learning about, maybe they're saying, yes, they do know it, but we're confirming whether it's following the process and procedure that's written in the policy. So are they cleaning high to low? Are we cleaning clean to dirty? Are we using the correct cleaning products, following the contact time, things like that, just to get a little bit more information. Um, and so in these tours, we review quite a few different areas within the facility, such as a staff break room, activities and therapy room, maybe soil utilities or hopper rooms. We'll take a look at the process for communal dining, hand hygiene, and PPE, and also inquire about processes for your immunization program. This tool is not solely used for these tours, so this could also be used as a reference. That you guys can use independently as you're doing your own audits and tours. So next we have the kind of an open-ended question. If you guys could enter into chat, what is a barrier that you've encountered when you implemented a new infection control intervention? And so we'll just give everyone a moment. And Ro, are you seeing anything come in through chat?
Yes, we have Toby said compliance, we have staff compliance, staff buy-in, a lot of compliance.
Yeah, absolutely. Absolutely. And that can be challenging with the staff compliance. And so one of the things with overcoming challenges, so right, first bullet right there, maybe staff are resistant to change, but what I already do is already working. Or maybe we have a limited time for regular rounding. Maybe we have resource constraints or some challenges with accountability. Um, and so you guys are all wearing multiple hats, sometimes having to work on the floor. And so some things that we could do are making sure that we're providing staff with the right tools and resources and having that sufficient training, providing incorporating rounding into everyday practice and engaging multidisciplinary teams within your facility. So this would be used to or could help to help prevent it's called the Hawthorne effect. And so this is where someone's behavior may change due to their awareness of being observed. So maybe we have something set up where we have an environmental services manager who is kind of observing the nursing department on cleaning and disinfection of equipment. Or maybe a nursing lead could be monitoring therapy services with donning and doffing of PPE. Or maybe we could even have the residents assisting us with observations for staff members that are coming in and whether they're performing hand hygiene when they're entering. These could be some other ways to get more team members involved. And then impact. So, how do we track our success? How do we know that we're meeting our goal in reaching sustainability? Well, maybe we're reviewing our infection rates for MDROs or the number of residents on enhanced barrier precautions, or maybe we're reviewing our compliance with cleaning and disinfection. Things to consider are who we are sharing this information with. I know oftentimes we have these our performance improvement plans, and we're sharing and reporting out during QAPI. But what about the rest of your team within the facility? Do your team members who are involved know exactly the new intervention and the progress that they're making towards the goal? Do they know how we're tracking success? Those would be some really key factors. And again, making sure that our SMART goal is specific, measurable, attainable, relevant, and timely. Okay, so really excited for this section. I would really like to now I will introduce to you Toby Haldeman Wheeler. Toby is an infection preventionist at Apostolic Christian Restmore, and she has some really great stories that she's going to share today with how she's identified opportunities for improvement within her facility, obtaining staff buy-in, fun educations and interventions that she's had a lot of success with. So, Toby, I'll now hand the floor over to you.
Thank you, Mariah. Hello and welcome everybody to Legend. I've been really enjoying the series that we've been going through. I really was grateful to have you come and check out our environment and see what we're doing here firsthand and give the feedback that you had for us. That was a really good resource for us. So I appreciate the hard work that you do as well. One of the things that's a success story that I want to share was what we've done with our flu vaccination compliance. So a little bit about me, I'm a very visual person and I'm about a 6 on the weird spectrum. So when I came to AC Westmore, my main goal in infection outside of my office was to engage the staff. I wanted to make IP fun, get people interested so they felt involved in a part of the chain of infection. I walk daily all the halls. I check areas, greet staff, make sure that the clean linen parts are closed, and I'll just stop by and chat with the CNAs, ask the nurses how their day is going, just make sure that they know who I am and know that I am going to be visible in the community. I have routinely posted cooties throughout the community to remind staff that those little pathogens are everywhere. On the middle picture on the screen, you'll see that this is my little rhinovirus, and he's got facts on it that says that the spore can live for 24 hours on hard surfaces. I'll laminate these and stick them out throughout the community with double side tape. And I put them by high touch surfaces like door handles, phone receivers, light switches, carts. They're big enough to notice, but they're not small enough to be obtrusive. And I don't put them in resident areas. I just put them in staff areas, areas where the staff is going to be hanging out. One of the most important things about posting these kind of things is to make sure that you're switching it out. So I'll change over these little fact cooties with what I call my snot cooties, and that's the little green guys with the big cheesy smiles. They're talking about chain of infection. Like one of them asks, "Will you be my susceptible host? Can I hitch a ride with you?" Or "Hey, hand sanitizer isn't real important. I want to hang out with you." Just cute little blurbs that I can post throughout the different locations that they're going to see and it's going to bring infection prevention to the forefront. So when we came to our flu vaccination participation, prior to my tenure, our compliance with flu vaccinations was around 45%. So I established a goal with management that we would increase compliance by 10% from last year. And I thought it was very reasonable, not too outlandish. And after setting up the goal, I planned on how to get the party started. So I scheduled the clinic for the 10th of October, and I made sure that all of the staff members, the nurses, knew that I was doing the vaccinations, that this was something that they were not going to be responsible for. I was going to take care of it 100%. And for the first 10 days of October, I started making flu vaccination the daily topic. I would send out an email, I would post posters, I would write notes on the refrigerator board. We have a memo board in the refrigerator, and just remind people that flu vaccine is coming up. Have you turned in your paper? And so I talked to the nursing staff, made sure that the CDC posters were around, and then about midway through, about 5 days before the infection clinic, on the first picture, you'll see these little clothespins, and I glued a little cootie spore. It's a flu virus. And on it, it says, "You've been infected with the flu, go infect someone else." And I went out on the floor and I very sneakily clipped these clothespins on staff members. And when they noticed that they had the clip, then they saw that they were supposed to infect someone else. So I can see cameras in my office. So I came back to my office and just sat and watched them all running around the hallways, just having a blast, trying to clip these clothespins on each other. And I let them play that game for an hour or so. And then I went over the intercom and said, "If you've been infected with the flu, please meet me in the dining room." And so obviously everybody had been infected by the flu by this time. But I told them that in that face-to-face conversation, that I gave them some fast flu facts and explained just how quickly the flu can spread just by playing this game. And so by putting it into that kind of terminology, just a visual for them, they could see how quickly a flu virus could spread. And they had a really good time with that game. So we held the clinic during working hours. It was for COVID and flu for the staff and the residents, both on the same day. And then I offered a special day or time for third shift, and then also made appointments with certain people that if they only worked once a month or every other weekend or something like that, everyone had an appointment. They either had to get the shot, elsewhere and bring me documentation, or ask for the exemption. So that was the 100% compliance we were looking for, one of those three. And by the end of the clinic, we had 86% vaccination rate for all of the staff and a 97% compliance rate, which completely floored me and the administration. 97 compliance rate was just absolutely awesome. The administrator was pretty stoked about that, so he decided that all the departments that had turned in 100% compliance, we did drawings in those departments for a $25 gift card for each of those departments that reached 100% compliance, meaning they either got the vaccine, got it elsewhere, or got the exemption. On the next slide, one of the other things that I do, I send out stories, emails, poems. We had ended our COVID outbreak the night before Thanksgiving. And so I sent this out to an all staff email, and just thought it was pretty cool to let everybody know that they could take the masks off. And on the next slide, one of the other times that we came out of, this was earlier in the year, we came out of an outbreak, and this was one of the emails that I sent out. I just try to make it playful and fun, but I also ensure that I'm reminding them that hand hygiene or whatever the particular goal is for that month that we're working on is part of that communication as well. So just keeping them involved, making it fun, keeping them up to date, lots of communication. I don't think you can over communicate what's going on in your infection control department. We just had another outbreak start today, and I let everybody know with the big news bulletin that we'd keep them posted, and encouraging them to continue with hand hygiene and to do their best to continue to wear PPE when they're managing our residents that are in transmission-based precautions. So engagement, lots and lots of engagement, and it's been fun.
This is all really awesome. I love to hear all of these stories and interventions, Toby. They are so creative, so innovative. And it brought a lot of excitement to our team hearing about this. So I was just we were very eager to have you share this with everyone on this call. So thank you so much for sharing all of this. I really enjoy hearing about the successes that you guys had at your facility, and I hope that everyone can take some of these ideas and implement it at your facilities as well.
Definitely steal the ideas. I'm good with it.
Yeah, no, this is wonderful. So thank you so much, Toby, again for joining us. In all, to everyone, implementing processes can be really challenging, and infection control, along with everything else, it's just a really big bear to tackle. So I, along with the rest of my team, just want to remind you all that you're not alone. We're right here during these calls. We have a supportive community. So if you too have ideas, interventions that are really creative and innovative, please always feel free to share this into chat. Or if you're looking for ideas, please connect with with us or your facility point of contact. Just to kind of just walk through some things and so that we can all work together towards the same goal. So with that, I'll leave it open to if anyone has any questions, I'll hang out for a little bit. Please feel free, come off of mute, put it into chat. Um, Here are just some general, for if you'd like to contact us, we have general inquiries and specifically for nursing home outreach. And then if you are looking to learn who your point of contact is again, please let us know and we'll get you connected. This week, we still have a couple more sessions going on. So Thursday, we have a nursing home quality as essentials, ensuring resident safety, facility assessment, and COVID-19 preparedness. Starting next week on Tuesday, we have reducing COVID-19 related pneumonia, pneumococcal vaccine guidelines made simple. And then on Thursday, the 26th, we have health literacy, viruses and vaccines. So with that, it concludes our presentation for today. Thank you all for joining me. And until next time, thanks again.